When choosing a case profile, when you open a new case, there are numerous case profiles available. A default is your typical geriatric Medicare type adult population. It has a lot of categories built in for that population. There's a pediatric eval, a sensory pediatric eval, as well as a basic eval. A basic eval is used if you don't need all of the pre-built categories that are in the default or the pediatrics. It is more of an open model, stripped down eval that you can use. It still has billing and coding, so you can still submit it to insurances or generate a super bill. The billing profile is a very rare occurrence. That is only if you don't need to really be documenting in our system, but you just need to generate billing. So some people work in certain circumstances where they have to use another documentation platform, but they still need to bill it through their own platform. They could just put in the billing codes for the dates of service. And then the wellness is a quick SOAP note. It is a note that will not generate a super bill. It does not have any billing or coding, so it's used for self-pay patients that either are true wellness, or if someone does not need a super bill, that's what the wellness document will offer you.